I would like to call your attention to a really great statement. Remember, if you've been on our past webinars, he's a giant, a legend in the field of nutrition, and of course, he's the one who named folic acid, which most pregnant women have to take to prevent birth defects in their babies. And here's what he says, or said: the human body heals itself, and proper nutrition provides the resource to accomplish that task. Nutrition, nutrition, nutrition. So few people really understand the power of that. And before we go on, I just want to mention that there are lots of companies and lots of organizations trying different kinds of nutrition to help in different kinds of conditions. And I would just like to recommend strongly, very strongly, Dr. Reg McDaniel, who is the founder and director of the Fisher Institute for Medical Research. He has been doing research on patients with all kinds of problems, and they have been getting tremendous, tremendous results, even results that we were trained in medical school were impossible to get. So you would like to get his number, and if you missed it, we can type it in for you. Get his number, and they actually do research, and they can provide the nutrition for you, the nutritional supplements at a third of the price. So that would be something you would like to do and know about. Again, we can send you the information later on. The thing is not just about nutrition. It is not just about medication. It is really about a complete picture. And here we have a few of the things that we feel are extremely, extremely important. Remember, folks, I'm a passionate believer in the power of modern medicine. If you're looking for a place where they're going to lambast the medical system today, well, you won't find it here. You need to go somewhere else. We truly believe in in medicine. We truly believe in modern medicine. And the only problem is that modern medicine is practicing to the exclusion of the other aspects, and that is what we're here about. We want to help to bring in those areas that are neglected for the most part by modern medicine. And to help explain this a little bit more, I just think this is a great, we're so glad when he contacted us. And Gary Sanford, in the next few moments, is going to be talking about his story and how he fought and overcame cancer through integrative medicine, which is a combination of all the different things, nutrition as well as modern medicine. So, Gary, are you on the call?
Yes, I am.
Okay. You sounded a little faint there. Could you?
I just pulled my phone off the speakerphone. Can you hear me okay?
We can. Maybe better if you, it's still a little faint though.
Gary, we're hearing you through the microphone. Did you actually call in?
I'm on the, okay, I'm on the phone next to my computer.
Yeah, for just while we're wanting to hear you speak, you might want to do the dial-in, the phone number and access code. Just
he has. I think he has.
He's.
Gary, we can hear you, but it's. Are you on your phone?
I'm on the phone right now. I'm on the speakerphone right now. I'll take it off and get it better.
Maybe it might be a good idea to go to another room and speak on the phone from the other room. That might help. Did you put in the PIN number?
Yes.
Okay.
In the system, he's not showing up as having dialed in. He's just showing up on his microphone.
Oh, really?
Okay. I've got the computer here as well as my phone.
Gary, we're going to send you a chat message, and what we could do, we'll try and sort that out. Probably, maybe we should we can put this to the end, and then we'll just try and sort it out so we don't keep people waiting. But I'll send you a chat message, and then I think Moira, we'll let Moira continue with her presentation, then we get back to your story afterwards. How about that?
That'd be fine.
Okay, sorry about that. All right, let's move on to. I have some really cute pictures to show you guys, but all right. Moira, are you on the call?
Yes, I'm here.
Okay, good. Sherry, why don't you introduce Dr. Dolan, and then I'll just send some text messages to Gary. Okay.
I hung up. It told me to get off.
All right. Okay, Dr. Dolan is a board-certified internal medicine physician. She's the Executive Director of Medical Accountability Network, an educational resource dedicated to establishing integrity in medicine. Dr. Dolan addresses the ability of participants in all aspects of the professional and public communities affected by medical issues. Dr. Dolan is also serving as a medical consultant for the state of Texas and the Office of the Texas Inspector General. She's the editor of the subscription website SmartMedInfo, and I think we'll be seeing that on the screen, which defines a new role for the payers and patients in their healthcare decisions. I really recommend that you go look at her website. Dr. Dolan's presentation, she does this in a totally lay language with real-life examples that really do communicate to everyone. And this education empowers employees and just the average person with a responsible role, and it really helps people obtain their own optimal health, take control for their health. So this is going to be a great webinar tonight. We're very thankful that she has joined us. So we'll hand it over to you, Dr. Dolan.
Well, thank you for that introduction, Sherry, and thank you, Dr. David, for having me on again. I do look forward to Gary sharing his story after I do this presentation. It's very interesting and will be very encouraging to a lot of patients. So I was asked to talk about cancer and nutrition, but that is such an immense field that I really had to narrow it down to cancer and micronutrients. So basically I'm talking about some vitamins and minerals, and even there I had to narrow it down further. And what I decided to do was go over the various nutrients that have a lot of medical literature behind them. So there's obviously well more than what I'm going to be able to cover in the next hour, but this basically gives you a background in the nutrients that have been very well studied along conventional medical lines. So we'll start off. I did want to mention SmartMedInfo.com is, as Sherry said, a subscription-based medical information site that's completely unbiased. We're not selling anything. Unlike other popular medical information sites, we are completely unbiased and will give you the lowdown, the true dope on various medical conditions, tests, and medications that you may be offered, simply so that you can consent to a treatment or a test with full knowledge rather than just feeling like you're the victim of whatever's being pushed on you. So starting off with vitamin A. Vitamin A is found in fruits and vegetables in the form of actually a provitamin. Provitamins called carotenoids. But most of these carotenoids have to be changed into an active form by the body before they can be used. Now this is different from vitamin A in animal foods, which is already preformed. It's called retinol. So in things like liver, eggs, cheese, and milk, you can find retinol. Whereas in the vegetables, it's in the provitamin form called carotenoids. And of course, some of our foods are then supplemented further with vitamin A, like it's added to cereals and breads. Now, of the different types of carotenoids in fruits and vegetables, the body's best at converting beta-carotene into a usable form to be used on a cellular level. And you can get this from yellow or orange fruits like carrots or cantaloupes, apricots, papaya, mango, peaches, sweet peppers, sweet potatoes, and also from dark leafy greens like kale and spinach. Now, some of the carotenoids, such as lycopene, lutein, and zeaxanthin, they don't get changed into vitamin A, but they too are nutrients that really keep the body healthy. Specifically, they act as antioxidants, scrubbing the body of these free radicals that can be damaging at a cellular level. So we know that vitamin A is involved in making healthy eyes and skin and bones, and it also maintains the health of the surface linings of the body, and that includes the entire breathing tube system and the lungs, the urinary tract, and the intestines. So these are all areas of our body that have the connection of the outside going to the inside. So our respiratory system, urinary system, and intestinal system. And what vitamin A does is it makes these lining tissues a very strong barrier against bacteria or viruses or other toxins. But aside from that, vitamin A also has a role deeper in the body in cell production. It actually regulates the making of new cells, and it assists in cell division, and also determining what kind of body part the cell is going to become part of. We call that differentiation. And vitamin A also helps to regulate the immune system and actually helps to make infection-fighting white blood cells. So you can see, like so many other vitamins, vitamin A is just really essential to a whole range of body structures and functions. Now, there's a great deal of evidence in the conventional medical literature to suggest that getting plenty of vitamin A in our diets will reduce the risk of breast and prostate cancers. There's one study that was just published this year looking at the plasma levels of beta-carotene and other antioxidants that comes from eating a really balanced diet, and they looked at what are the plasma levels in the blood and how does it relate to who's at risk for getting cancer. They took a look at hundreds of women who had ovarian cancer and cervical cancer, and they compared them to the blood levels of these beta-carotenes and other antioxidants in women who didn't have these cancers. They also measured two forms of vitamin E, alpha tocopherol and gamma tocopherol. Well, they found that women that had the highest plasma levels of any of these micronutrients were at the lowest risk for ovarian cancer. Specifically, women who had the highest blood levels of carotenes only had 1/10 the risk of ovarian cancer as women who had the lowest blood levels of carotene. Same for lycopene, which is one of these carotenoids that doesn't get changed into vitamin A but works a lot like vitamin A in the body. It's the one you can get from tomatoes. The other ones, zeaxanthin and lutein, the women who had the highest blood levels of that had only 1/5 the incidence of cancer compared to the women who had the lowest blood levels. Retinol, that's the vitamin A that's found in animal foods, the preformed vitamin A. They found that women who had the highest plasma levels of retinol had only about half the cancer risk of the women who had the lowest plasma levels of retinol. And again, we're talking here ovarian and cervical cancer. The numbers for the vitamin E was sort of around 25%. The people who had the highest plasma levels of vitamin E had only about 1/4 of the risk of these cancers as women who had the lowest levels. Now again, these levels were just drawn based on whatever was already in their bloodstream from whatever they were eating. In other words, they were not taking supplements in particular. There's another study that just came out this year, a huge study done by Harvard researchers published in the International Journal of Cancer that compared the diets of nearly 6,000 women who had invasive breast cancer to the diets of women who didn't have cancer. And what they did is they gave them these very detailed interviews asking them about what their eating habits had been for the past 5 years. And they found that for women who were premenopausal, they had a much lower risk of invasive breast cancer if they had for 5 years been eating a diet that was rich in foods that had a lot of vitamin A, beta-carotene, alpha-carotene, and lutein and zeaxanthin. And there was especially a strong protective effect if the person was a smoker. Whereas after menopause, it didn't matter what you ate in terms of your risk of getting breast cancer. However, if you did get cancer, people who had a diet that was richer in vitamin A actually lived longer and survived better than people who didn't have a diet rich in vitamin A. So again, this study was done based on what they had been eating, and it was not based on supplements. We'll get into supplements a little bit later. Another supporting study just published this year of China of a little over 400 women with breast cancer. They compared them to age-matched women who didn't have cancer, and they found that the women who ate the most dark leafy green vegetables and carrots, tomatoes, bananas, watermelons, papaya, and cantaloupe, they had half the risk of breast cancer as the women who ate the least of these foods. And they found that this trend was not true only for vitamin A, but also for foods that were rich in vitamin C and E and also fiber. And that points up one of the difficulties in doing these dietary studies. You really can't isolate out, well, was it the vitamin A that did it? Was it the combination of the nutrients? Was it the whole food? What's the role of fiber? But certainly they are starting to tally up these studies saying, well, you know, if you eat foods rich in vitamin A, ovarian, cervical, and breast, at least in premenopausal women, you definitely have a decreased risk. Now, let's take a look at men and vitamin A. If they studied the blood levels of retinol, and remember that's the preformed vitamin A found in animals, and they said that they found that the higher the blood level of retinol, the lower the risk of getting prostate cancer. This was a study of nearly 700 men that came out of the Fred Hutchinson Cancer Research Center and was just published this year. The men who had the lowest levels of retinol were 42% more likely to have prostate cancer than the men who had the highest levels of retinol. And the strongest correlation was for the very high-grade prostate cancer, in other words, with the very aggressively mutating cells. In other words, they had the lowest retinol levels. So this was, you know, there's definitely evidence here of the protective effect of diets strong in vitamin A. Several other studies show that men that have high intakes of lycopene from tomatoes and tomato products were less likely to develop prostate cancer than men that had low intakes. The interesting thing about lycopene, it comes from tomatoes, but the more processed the tomato is, actually the stronger the lycopene concentration, in contrast to what we usually think of when we're thinking of healthy whole foods. But it turns out that cooking it, canning it, concentrating it in the form of tomato paste and ketchup, you're actually getting a higher concentration of lycopene than you get from a fresh tomato. Now, supplements of vitamin A, actually looking at taking extra vitamin A in a pill form, have been shown to prevent the precancerous stomach lesions from turning into invasive cancer. But regarding supplements, that's sort of the only area that it's really been demonstrated that taking, you know, a bottle of vitamin A off the shelf and supplementing yourself with A really is beneficial, because all these other studies I've been mentioning are really talking about what's the dietary intake of vitamin A. Now, the effect of these carotenoids and vitamin A on lung cancer is much more complex. There were 2 large studies that followed over 120,000 people for 10 years. And they showed that getting a high amount of carotenoids through the diet had no effect on the risk of getting lung cancer or not getting lung cancer, okay? But other large studies show that the more carotenoids you take, the lower your risk of lung cancer. So in this particular case, dietary intake of foods rich in vitamin A and carotenoids, you can find a study on either end of the spectrum, either doesn't have any influence on your risk of lung cancer or may decrease it. On the other hand, people who take high-dose beta-carotene supplements, so we're talking little, you know, vitamin A tablets, had a greatly increased risk of lung cancer, especially if they were smokers and had other risk factors such as asbestos exposure. This was a remarkable study because based on the laboratory actions of vitamin A, it was really predicted to be an anti-cancer agent. And there was a lot of fanfare when the study took off of supplementing people only with vitamin A and not changing anything else and following them. The largest study looked at people who were smokers and had been exposed to asbestos. This is a very high-risk group. Well, they ended the study prematurely because after only 4 or 5 years, there was a remarkable increased risk of lung cancer in the people who were taking the supplements. On the other hand, there was another large study that looked at mostly people who did not smoke taking supplements, and they found that there was not an increased risk of cancer in those folks. So regarding vitamin A and lung cancer, it's just all over the map. Most doctors these days are really not aggressively recommending vitamin A, especially high doses, and that would be anything over 10,000 IUs, international units per day, for smokers regarding the prevention of lung cancer. Of course, when you look at a person who may be a smoker but is a woman and has a family history of breast cancer, the vitamin A, the benefit may be more for breast cancer, and that's more of a risk to her, so she may still decide to take that. But you still have to be aware that the vitamin A may actually increase the risk of this other cancer. Now, there was just another big vitamin A and lung cancer study published in April of this year. And this one was not looking at supplements. It was just looking at the dietary histories of almost 80,000 people. They took dietary histories back in the year 2000, and then they waited to see who had developed lung cancer. And by 2005, it was already evident that people who got lung cancer were more likely to have reported that in addition to whatever they were eating, they were also on supplements of beta-carotene or retinol or lutein or these other carotenoids compared to people who remain free of lung cancer. And in this particular study, their smoking status did not matter. So if I have confused you with the data, it's simply because the information is very contradictory. So it does seem that supplements, especially in high doses, may increase the risk of some cancers, particularly for smokers. Some studies have found this most profoundly, and other studies really haven't been able to duplicate it, and yet the latest one that comes out again shows that people who are taking supplements on top of whatever they're eating do seem to have an increased risk of lung cancer. Now, in summary, for vitamin A, what can we say? Basically, a diet that's rich in fruits, yellow and orange fruits, and red fruits and vegetables, and dark leafy green vegetables that has high beta-carotene content. It's definitely recommended for cancer prevention. But the risks of high-dose beta-carotene vitamin supplementation just may outweigh any potential benefits, particularly in smokers. So we will review that information at the end of the presentation in case you're taking notes. Now, here's just a little summary slide here. The dietary carotenoids may protect against breast cancer in premenopausal women, prostate cancer, ovarian cancer, and cervical cancer, and that's carotenoids obtained from healthy eating. But carotenoids as a supplement may increase the risk of lung cancer, particularly in high-risk populations. Are you still with me? Are you tracking with me here on this?
Sure.
Okay, good. I want to make sure I'm not overwhelming with all the figures. Now let's take a look at folate. Folate's a B vitamin that you mentioned, Dr. David. It's essential in the formation and maintenance of a healthy brain and nervous system. That's why we give it to women to prevent spina bifida in the babies. It helps to make the genetic material, DNA and RNA. It's a vital nutrient for the mother to take throughout infancy, and also for the baby throughout infancy, and especially during growth spurts, and particularly in the teen years. As with other B vitamins, folate helps the body burn carbohydrates to make energy. It helps the body metabolize fats and proteins, so it's involved in every aspect of using our foods. It helps to regulate red blood cells, and it helps the body to use iron. where can you get folate? It's in mustard greens, spinach, dark leafy greens. It's also in asparagus, turnips, beets, Brussels sprouts, all the things your mother told you to eat. It's also in beef liver. It's very richly found in brewer's yeast. Also in any kind of root vegetable, whole grains, wheat germ, bulgur wheat, salmon. Also in orange juice, avocado, and milk. Now, breads and cereals are artificially fortified with added folic acid. And note what I said there. I said folic acid, not folate. It's folic acid that is used to fortify bread, and that's because it's actually more readily taken up and used by the body than the natural folate found in vegetables. But there can be a downside to that. Studies show that the naturally high folate levels from foods lowers the risk of some cancers. People who eat a diet rich in folate have a lower risk of leukemia, cancer of the lungs, pancreas, esophagus, stomach, cervix, ovary, and breast, and a rare childhood tumor called neuroblastoma. People who have high levels of selenium, which is a mineral, we'll discuss that later, and folate, if they have high levels of both together, they have a decreased risk for colon cancer. When only selenium or only folate is high, oddly enough, there's no protective effect. So these two nutrients must work in some way together, where you really have to have high levels of both. People who have low folate levels have an increased risk of cancer of the liver. Men who had a naturally high folate level tended to have less risk of prostate cancer. Men who ate more fruits and vegetables had less risk of prostate cancer compared to men who tended to eat more grains and protein. In breast cancer, it really depends on the genetics of the cancer cell type to determine whether or not folate protects against it. Some breast cancer is more likely in women who have, believe it or not, high folate levels, whereas some other types of breast cancer is less likely in women who have high folate levels. So it's not really straightforward there. Now, I mentioned earlier that the way that cereal and flours and breads and pasta are supplemented is not with folate, but with folic acid. And when folic acid is actually given as a supplement, it has been shown to increase the cancer risk. So I just got through describing all these cancers that you had a decreased risk of if you had a naturally high folate level from what you ate. But if you go on and take a folic acid supplement, it's a different story. One study showed that men who took folic acid supplements had a higher risk for prostate cancer compared to men who didn't take a supplement. On the other hand, people who had a high folate levels just from their diet had a lower risk of prostate cancer. A couple of large studies have looked at rates of colon cancer, and we have found increased rates of colon cancer in the United States and Canada ever since flour has been fortified with folic acid. The reason the flour was fortified is because we know that a folic acid deficiency will cause defects in the spinal cord formation in the developing baby in the womb. And so an easy way, instead of trying to get the whole world to take folic acid vitamins, is to just put it in the bread. And then anybody who maybe they don't even know they're pregnant, they're so early on in their pregnancy, but if they're eating the bread off the shelf, they're going to get folic acid. And as a result, we don't tend to have the rate of spina bifida, deformity, babies born deformed like this like we used to. On the other hand, ever since our food system has been, especially these grains, have been supplemented with folic acid, we're definitely seeing increased rates of colon cancer. A study in Chile also found that colon cancer rates were significantly increased ever since folic acid fortification started in that country. Yeah, and now people that have precancerous polyps of the colon, so these are little growths in the colon that aren't yet cancer, but given enough time tend to convert over to cancerous tumors. If they actually took folic acid supplements, they had a higher rate of more polyps, polyps just continuing to come back, and also more multiple polyps. They would have more than one, and they would also progress to invasive polyps going over into cancer compared to people who had these polyps but did not take folic acid supplements. So the bottom line with folate is folate in the diet really seems to be good for you. Folate deficiency definitely predisposes you to getting many different cancers. But folic acid supplementation can make existing cancers grow more and may even promote the development of cancers. So this is very interesting. We take a public health policy, of just throwing folic acid in the bread, and for one group and for one purpose, pregnant women, to prevent these neural tube defects, but then everybody takes it, and we find in the rest of the population they're increasing folic, colon cancers. So another, but it's just another example of, nature knows best, and when man gets in there and starts to mess around, we get a different story. So I'm sorry I'm a little behind on my slides here, but I thought this was such a beautiful slide. We'll let you look at that for a little bit there. So yeah, the folic acid supplements can increase the cancers. So folate in foods can prevent a variety of cancers, but folic acid as a supplement may actually promote some cancers.
Now the question that would go through my mind, and I'm sure some people in the audience would be, could it have just been because it's specifically a synthetic folate, or because it's not in a food matrix? It's just a single
well, that's the question with all of these studies. Of course, in a natural system, none of these nutrients works in isolation. And so when you take it out and try to study it as in the same manner that we study drugs, you see some things that you didn't expect. So you wonder if giving, for instance, a folic acid supplementation, you wonder if that isn't causing a deficiency of other vitamins, because you're overdosing maybe on one, and of course all these vitamins work together. For instance, folic acid's action on metabolizing carbohydrates, proteins, and fat is done in conjunction with other B vitamins. But if you're supplementing only folic acid, or supplementing folic acid out of proportion to your other B vitamins, you may actually be consuming those other B vitamins at a higher rate and inadvertently creating a deficiency of the other nutrients. And that's what may be predisposing to cancer rather than the folic acid itself. We do know that folic acid is more readily taken up and used by the body than the folate we find in foods, but like the vitamin A story, where retinol is already preformed vitamin A, we find that beta-carotene form, probably, it's the one that's found in the vegetables and fruits, and the body has to convert it. It's actually a provitamin or a pre-vitamin. The body has to convert it into vitamin A, but that's probably the better form of vitamin A. So just because we find something that's easier for the body to take up and use doesn't necessarily mean that it's going to be better, and as we could see in the case of folic acid, maybe worse. So let's talk about vitamin C, also known as ascorbic acid. Now our bodies cannot make vitamin C, so we have to get it through the diet. It has many, many functions. It's an antioxidant, of course. Now the reason that it might have anti-cancer activity is that even in small amounts, vitamin C can protect and repair damaged genes, can protect and repair damaged proteins, fats, and carbohydrates. So again, like the B vitamins, it's involved in so many different body processes. So when you have these bodily structures being injured by toxins and pollutants, vitamin E, even in small amounts, can have a protection, and vitamin C can have a protection and repair function. So we find that eating foods rich in vitamin C is associated with a decreased risk for some cancers, but not necessarily others. And I'll go through these studies. Eating more vegetables and fruits that have vitamin C definitely lowers the risk of getting breast cancer, cervical cancer, ovarian cancer, as well as cancer of the mouth, throat, and vocal cords. Also reduces the risk of cancer of the esophagus, the stomach, the colon, the rectum, and the lung. Now again, this is dietary, obtaining vitamin C through vegetables that are very rich, and fruits that are very rich in vitamin C. One study found that eating foods rich in vitamin C reduced the chance of lung cancer in middle-aged smoking men. It just looked at that population, a very high-risk population for lung cancer, and they found a definite reduction if they had a vitamin C-rich diet. Now, some studies have also found that diets rich in vitamin C seem to protect against getting prostate cancer, but other studies have not shown any protection. So the studies on prostate cancer can go either way. Now, some studies have shown that vitamin C-rich diet protects against colon cancer, and we do know that people who have cancer of the colon do have lower serum levels of vitamin C than people who don't get colon cancer. And yet, the studies that are showing a trend toward protection are a little bit weak. They're not really, the evidence is not that outstanding. One study looked at vitamin C and the relationship of non-Hodgkin's lymphoma, which Gary will be talking to us about lymphoma later on, and they didn't find any relationship in that case. And again, we're talking about dietary source. One huge study that gets cited for all kinds of things is the Nurses' Health Study. This is where they took tens of thousands of nurses and had them fill out health and dietary questionnaires every year for about 20 years and looked back and said, okay, who got what and what did it have to do with what they were eating. And in the Nurses' Health Study, they found that premenopausal women who had a big risk factor, and that would be a family history of breast cancer, if they consumed an average of about 200 milligrams a day of vitamin C, and this was just estimated from the foods they ate, that they had a 63% lower risk of breast cancer than people who only consumed very little vitamin C. And again, we're talking about vitamin C that they get from just their foods, not from a supplement. So for the high-risk group of premenopausal women with a family history of breast cancer, a diet rich in vitamin C does seem to be protective. Another study was done in Sweden. They looked at women who were overweight, and they looked at how much vitamin C was in their diet. If they just consumed an average of 110 milligrams a day, they had a 40% lower risk of breast cancer compared to overweight women who hardly consumed any vitamin C foods at all. So we're talking about a very little bit of vitamin C can make a profound difference in the risk of breast cancer in these two studies. There was a study of almost 900 men. They followed them for over 25 years, and they just looked at what did they eat. And they found that the men who consumed more than, and this is such an odd number, but they were just cooking up these numbers based on formulas. Okay, if they eat this, this, and that, this is how much vitamin C they're getting. They said that men who consume more than 83 milligrams of vitamin C a day had just a striking 64% reduction in lung cancer compared to the men who had hardly any vitamin C at all. So a little vitamin C goes a long way. Now there's other studies that show that taking vitamin C supplements does not protect against cancer. Now the criticism of these studies is that they were supplemented in far too low doses to expect anything to happen. One study showed that supplementing with 500 milligrams of vitamin C didn't protect against the risk of total cancers, like any cancer. Supplementing with 500 vitamin C didn't protect against death from colon cancer or prostate cancer. Another study showed that supplementing with vitamin C did not reduce the risk of getting ovarian cancer. In fact, one large study actually showed that smokers who took vitamin C supplements actually had a higher death rate from all cancers combined. That was only one study, though. Two other studies didn't find, they were looking at stomach cancer. They said people who take vitamin C supplements it doesn't reduce their risk of stomach cancer. So again, critics of these studies suggest that the doses that they used were far too low to expect any response. On the other hand, there's other studies that look at vitamin C supplementation and say, hey, it does prevent cancer. One study said vitamin C can prevent pre-cancer of the esophagus from transforming into an invasive cancer. One study showed that vitamin C supplements can prevent the risk of stomach cancer in people who have the H. pylori infection. So, you know, this is all over the map. And like I said, the people who've criticized these studies have said, well, the doses have just been far too low to expect to see anything. Now, there's been some concern about whether or not people who are taking cancer chemotherapy should actually take vitamin C because they're wondering, does it interfere? It turns out that most of the studies that have looked at vitamin C in treating cancer have used vitamins that are being taken by mouth, okay? Some research has shown that really you have to take vitamin C in IV form to get high enough ascorbic acid levels to really reach and kill any cancer cells, and that people taking it by mouth would not be expected not only to not interfere with cancer chemotherapy, but also wouldn't help the cancer cell, wouldn't treat the cancer cells. The other problem with these vitamin C studies during cancer treatment has been that they've mostly been done on patients that were already deemed to be terminal and hopeless. And they were done on the most extreme end of patients, and also for very, very short time periods. So when you combine that with the low dose and taking medication by mouth rather than intravenous, again, some critics feel that all these studies need to be done over again. And
right.
You know.
And
the other
thing
is most studies in vitamin C, when they're giving supplements, they're really recording very carefully the supplements that the patients are taking, and they compare them to control groups. But a lot of people pop vitamins at home, and they don't necessarily report that. So they could be comparing to a group who's also taking vitamin C, and that may be one reason for the studies that, you know, for the results that are sort of lukewarm. Now, there is certain types of chemotherapy actually are known to really quickly destroy the body's vitamin C, and one of these is interleukin. It's used for certain cancers, and it's also used to treat some viral infections. And it can cause such a sudden decrease in your body's vitamin C that it can cause acute onset of scurvy, which is something that sailors used to get when they were deprived of fresh fruits and vegetables on long sails. And somebody can actually get acute scurvy, and it needs immediate treatment by IV vitamin C. There is some evidence that it's possible that low doses of vitamin C could block the anti-cancer effect of some chemo drugs. There was one study where they had leukemia and lymphoma cancer cells growing in lab dishes, and all the cell cultures were given just one of 5 chemo drugs, very common different chemo drugs. And then these cell cultures were treated with vitamin C. And when they were treated with vitamin C, the cancer cells became resistant to the chemotherapy drugs. And this happened across this whole spectrum of 5 very, very different chemo drugs that work in different ways. And this is what raised the red flag, and that's why some cancer doctors actually don't recommend taking vitamin C during chemotherapy. So again, this was a study that was done in a culture dish in the lab, and it may not really reflect what actually goes on in the body. Because in the body, you have normal cells that are competing with your nutrients. They're competing with the cancer cells in order to survive. So, you know, most doctors are saying we really can't draw any conclusions to this. Some are really condemning their patients for taking vitamin C, and that seems to be premature. You know, the more important question might be, what is the effect of vitamin C on normal cells and their ability to outgrow the cancer cells? You know, maybe that should be tested rather than, you know, testing these cancer cells. And there's, on the other hand, there's other studies that definitely show that higher doses of vitamin C could help the response to chemo and radiation, especially if it started in advance of treatment. And again, that makes me think that, you know, what you're really doing is you're strengthening the healthy reserves that the body does have so it can tolerate these sometimes toxic therapies much better. So with vitamin C, the studies are kind of all over the map.
And Moira,
Yes.
with when you mentioned vitamin C, I know you and I discussed this with Linus Pauling, who won 2 Nobel Prizes and has about 48 PhDs. And he was the one who began to speak about vitamin C, megadoses now of vitamin C given IV as being very effective against cancer. Did you study any of what he said?
Yes, and that's the whole thing, you know, is that he's got, there are some studies that show that they weren't long enough, they weren't large enough, they weren't, you know, with effective comparison groups. So what his studies show is that there's definitely enough evidence there to do more studies. But, you know, with vitamin C not being something that anybody's patenting and no drug company's really going to put up the money to, you know, study it, we're unfortunately left with the studies that have been done so far. Now, the Linus Pauling Institute continues to do research, but, you know, you really have to, you know, we're talking about really needing large numbers and following them for long periods. And again, the study of vitamin C has just been kind of disabled, I would say, by these studies that have given it at much lower doses in an oral form, and they just have these conclusions so that a lot of people then are not interested in studying it further because they think the conclusion is already there, no need to study it.
Right.
So, you know, all we could say is that vitamin C as a supplement, that the evidence isn't really conclusive. And there's some studies to suggest it could interfere with chemo, but other studies that say the opposite. So certainly dietary vitamin C is protective. And again, what we may be looking at there is vitamin C does not work in isolation.
Right.
But to condemn somebody for taking vitamin C during chemo, I think that's really ridiculous myself. Okay, let's look at vitamin E. Vitamin E is actually a whole group of nutrients. It's a group of 8 different antioxidants, the alpha tocopherol form being the one that the human body uses the best. And you can get alpha tocopherol from, again, green leafy vegetables, vegetable oils like olive oil, sunflower and safflower oils, and also nuts and whole grains. And vitamin E actually keeps the microscopic body parts, the cell walls, from being destroyed by toxins. Now, it's interesting interaction between vitamin C and vitamin E. Vitamin C can regenerate used up vitamin E so that it can keep on repairing and maintaining body chemicals and tissues in a healthy state. So vitamin C acts to regenerate it. Whereas if you don't have enough vitamin C around, once you use vitamin E, then it's just a waste product after that. But if you have C, it rehabilitates the vitamin E. So vitamin E also regulates signals that influence the immune system and also regulates inflammation. So based on these cellular actions of vitamin E, there's a lot of hope that vitamin E would be a real strong anti-cancer vitamin. But the studies are a little bit disappointing, so we'll go over them here. We do know that vitamin E, when it's added to cell cultures grown in lab dishes, that it could have some anti-cancer effect. Vitamin E in its ester form, that's called alpha tocopherol succinate, causes some cancer cells to die. I mean, it's actually toxic to cancer cells. It also kills cancer cells when it's injected directly into tumors, and this is from animal studies, not human studies. Now, this alpha tocopherol succinate is not the form of vitamin E that we get most readily from food, and it's not the form of vitamin E that you normally buy at the health food store. But that's what the studies have been done on regarding lab cultures of cancer cells and also tumors in animals. Regarding vitamin E and cancer in people, they've done large studies here and there, and they really have not been able to demonstrate any fewer lung cancers or breast cancers in people who had diets that were rich in alpha tocopherol. The large study called Women's Health Study, they looked at the women who actually took supplements of 600 IUs of alpha tocopherol, every other day for 10 years, and they found it had no effect on overall cancer incidence or cancer-related deaths. Now, some would say that's an odd regimen, 600 every other day. You know, people who really study vitamin E feel that, you know, a minimum of 800 for a woman and a minimum of 1,000 for a man is what's really needed to really see an effect, and that's every day. So why they chose this dose and an odd every other day dosing, I don't know. Let's see, there hasn't been, you know, they've looked at vitamin E on breast cancer, lung cancer, colon cancer, and there's really no strong evidence that it's protective there. There was a recent big analysis of 12 different studies, randomized controlled studies, and they combined all the results, and they looked at people who were actually taking vitamin E supplementation. And just combining all the results of these 12 studies, they couldn't find any decreased cancer incidence or cancer deaths or total deaths from any reason. However, vitamin E supplementation may possibly reduce the risk of prostate cancer. One study showed that smokers who took 50 milligrams of a synthetic alpha tocopherol had a 34% reduction in the incidence of prostate cancer. Another study combined the results of this one study with 3 other studies, and all looking at prostate cancer, and they found that when they combined the results of all 4 studies, there was a 15% lower risk of prostate cancer. So there does seem to be some effect there with prostate cancer. Another trial looked at the effect of vitamin E and selenium. And they said, okay, what if the person just takes vitamin E alone? What if they take selenium alone? And what if they take them together? They actually stopped this study early because the people taking vitamin E alone actually had a trend toward a higher incidence of prostate cancer. It was just a trend. It actually didn't it wasn't what we call statistically significant, but there was a trend. And that's with the vitamin E alone. They didn't see that trend when E was given with selenium, and this just underscores the problem we have of studying nutrients which don't work in isolation in nature.
Right.
So there was another large study that suggested that use of vitamin E supplements might actually increase lung cancer, especially in people who were smoking. So, you know, it's a mixed bag. Now, vitamin E and cancer treatment, let me talk about that for a second here. I was able to find at least 19 studies of antioxidant supplementation during chemo. And these studies didn't show any interference with chemo drugs. Some of them included vitamin C, vitamin A, vitamin E, and they at least didn't show any interference. But they did show that vitamin E, along with calcium and magnesium, could prevent and actually treat nerve damage. That is a side effect of some chemo drugs, and also could possibly treat some mouth sores caused by chemo drugs. So the bottom line on vitamin E is that the majority of the evidence doesn't really find a role for vitamin E to treat or prevent most cancers, but it may be helpful for some chemo side effects, and it's not expected to interfere with the chemo drugs. So let's see here. Moving on. I'm sorry I'm going so fast here, but there's so much to cover. Calcium. Calcium is actually more of a macronutrient in that we really need large amounts of it. You know, like 1,000 times more is the minimum requirement of calcium than, let's say, some of the B vitamins. And it works in conjunction with vitamin D, so we'll discuss these together. So calcium is the most common mineral in the body. It's the body's main cell signaling chemical. It acts like a switch to turn cell function on or off. And it actually monitors nearly every vital function in the body, including regulating cell growth and cell death. Now, you've heard me say that about some of these other nutrients. Again, these don't work in isolation. Calcium in foods found in dairy products, leafy green vegetables, beans, tofu, broccoli, rhubarb. And we find that people who have high amounts of milk and other dairy products, they have a reduced risk of colon cancer, but not rectal cancer. Colon cancer is usually an adenocarcinoma, whereas rectal carcinoma is usually squamous cells. So again, it could be having to do with the different cell types. Taking high calcium supplementation does seem to reduce the risk of colon cancer. And taking high calcium supplements may also reduce the risk of rectal cancer. So if it seems like I contradicted myself, what I said there was diets that are high in calcium reduce the risk of colon cancer. But supplementing with calcium can reduce the risk of colon and rectal cancer.
Got it.
Another study showed supplementing calcium at 1,200 milligrams a day for 4 years significantly reduced the recurrence of the precancerous colon polyps. Supplemental calcium at 2,000 milligrams a day for 3 years in one study was found to reduce the recurrence of precancerous colon polyps. So they studied, we're talking 2 different studies here. One was only 1,200 milligrams, the other was 2,000 milligrams. And they both reduced the risk of colon polyps coming back again. Women who took 1,500 milligrams of calcium a day along with 1,100 units of vitamin D3 for 4 years had a 60% reduced chance of getting cancer of any kind. Now, that's really great for colon cancer, rectal cancer, breast cancer, and colon polyps. But when you take a look at prostate cancer, who knows? Some studies suggest that high serum calcium levels are related to an increased risk of death from prostate cancer. Now, we always have to look real carefully at what we're studying here. Could it be possible that these men who have high levels in their blood of calcium actually already had spread of the prostate cancer to the bones and it just wasn't detected by our scanning methods? So maybe what they were finding was not that the high calcium has anything to do with the death rate from prostate cancer, but maybe what they were finding is men who have prostate cancer that's already so advanced it's gone to the bones. We know that's going to cause the calcium to be too high, and maybe that's what we're looking at.
Right.
So we really don't know yet, and there's a lot of controversy about what to tell patients regarding calcium and prostate cancer, and there's even some doctors who are strongly recommending that men decrease their calcium intake. You know, on the other hand, we definitely have studies showing that eating high amounts of calcium reduces the risk of colon cancer. Calcium supplements reduce colon and rectal cancer and breast cancer, remarkably. So that's a hard one to make a recommendation. Now, when somebody's getting chemotherapy, the chemo itself often drives the calcium level down, and it's different mechanisms depending on the different drugs. So many researchers have actually recommended that chemo patients routinely get calcium supplementation, and they're recommending at least 1,500 milligrams a day. We do know that, as I mentioned earlier, calcium can prevent and reverse actually some nerve damage caused by some of the chemotherapy drugs. Calcium can also treat the mouth irritation and mouth sores caused by some chemo. And there's no evidence suggesting that calcium will interfere with chemotherapy. So calcium overall seems pretty positive. The question is simply what to recommend for prostate. Some studies show a possibly, dietary-wise, could protect. Calcium as a supplement actually decreases total cancers in women as well as breast cancer, colon polyps, colon cancer, and rectal cancer. So vitamin D has to be talked about right along with calcium because they're really co-vitamins. Vitamin D really assists not just the absorption but the utilization of calcium in the body and not just in the bones. It's really needed in order for minerals to be placed correctly in the bone, but it also regulates nerve and muscle actions. It helps control the immune function, reduces inflammation. It's even involved with genes that control cell growth and cell reproduction and cell death. So you can see how it might be an anti-cancer agent. Now, the best way to get vitamin D is to go out in the sun. The majority of our D comes from the sun interacting with chemicals in our skin, and that makes a previtamin. And this goes into the body and gets changed into another form in the liver. And then it goes to the kidneys, where it's finally made into vitamin D3, and that's the form that the body uses. Now, there's very few foods that have vitamin D. It's found in fresh salmon, tuna, or mackerel, and in some fish liver oils. So let's take a look at vitamin D and cancer. Now, lab studies of vitamin D, there's a vitamin D natural hormone called calcitrol, and it shows that studies have shown that this calcitrol causes cancer cells to die in the test tube and also in animal tissues, injecting it into tumors. People who have naturally high levels of vitamin D3 from a good diet have a decreased risk of getting some cancers. People who live in sunny areas of the country, for instance, and of the world, have a less chance of getting prostate cancer, colon cancer, rectal cancer, and breast and ovarian cancer, just by virtue of living in a sunny area. People who live in sunny areas but get colon cancer nonetheless, they tend to survive longer compared to people who get colon cancer that live in the north. Interesting.
Yes.
High levels of vitamin D3 in the blood are associated, get this, with a 72% reduced risk of getting colon cancer. And what they did is they just looked at people who got colon cancer, people who didn't. And people who had the highest levels of D3 had a 72% less risk of getting colon cancer than people who had the lowest levels of D3. People who had the lowest levels of D3 also had the highest overall death rates from all causes, not just cancer. Vitamin D deficiency is also associated with increased breast cancer risk and decreased breast cancer survival. One study showed that women who are vitamin D deficient have a 253% increased risk for developing colorectal cancer. People who have,
Wow.
Yeah, now on the other hand, in addition to that, people who have a strong intake of vitamin D are at much lower risk of getting pancreas cancer. So what about vitamin D supplementation? Well, women who took 1,500 milligrams of calcium along with 1,100 IUs of D3, I mentioned the study earlier, if they took it for 4 years, they had a decreased risk of developing cancer by over 60%. Taking 1,000 IUs of vitamin D per day in one study decreased the colon cancer risk by 50%. Another study found 1,000 IUs of vitamin D a day decreases breast cancer and ovarian cancer each by 30%. The other studies have ranged anywhere from 30 to 50% decrease in colon cancer, breast cancer, and prostate cancer by either increasing the vitamin D intake in foods or by sun exposure or by taking supplements. So in vitamin D, we don't really tend to see the problem with the supplementation being different from the natural form that we were seeing in the other nutrients. So what about vitamin D in treating cancer? Well, calcitrol, the vitamin D hormone, is currently right now being treated as a potential prostate cancer treatment. On the other hand, there is some conflicting information. There was one study that found that high levels of vitamin D, the higher your levels of D3, the less your risk for colon cancer. But guess what? It also found that if you did get cancer, you had a higher death rate if you had the high levels of D3. Very confusing. Another study was structured exactly the same way. It didn't find any higher death rate. So again, there's other factors that are operating here that we haven't put our finger on, and any nutrient is very difficult to study individually in the way that we study drugs. So what about chemo and vitamin D? Well, chemo definitely increases the risk of a severe vitamin D deficiency. And particularly the people receiving chemo for colon cancer should really ask their doctor about replacing vitamin D3 preventively and during that treatment. So the overwhelming evidence supports really an aggressive use of calcium and vitamin D to prevent most cancers. The only controversy is with prostate cancer. where it's not clear if calcium is going to prevent or promote it. You know, a safe route for men may be to get a blood test for the levels of vitamin D3 and to consider supplementation if it's too low. And again, D and calcium work in conjunction. Now, regarding getting calcium, by the way, multivitamins are not a good way to get calcium. It's so bulky, and the multi-pills are too small to really include enough calcium. And also, calcium sometimes can prevent the absorption of other nutrients you take at the same time. And some calcium tablets aren't absorbed at all and come out the other end looking exactly the same. So the best way to take calcium is in a dissolvable powder form. Now, since calcium can cause constipation, it's a good idea to take it with magnesium. You take it a 2-to-1 ratio, 2 calcium to 1 magnesium. Now, vitamin D supplements are sold in 2 main forms, either D2 or D3, and it's the D3 form that you want. That's cholecalciferol, D3, and that's more readily used by the body. And there's just no agreement as to what's the best amount to say. But the prominent researchers in this field strongly recommend no less than 1,700 IUs a day. And so far, we haven't found any significant toxicity, even with those doses.
We had Dr. Owings on about a couple of weeks ago who talked about vitamin D, and she said she recommends about 5,000 international units.
Yeah, she was talking about more for the
heart.
For the heart, yeah. So it depends on what you're treating there. You know, for the bone too, you want a minimum of 1,500. So.
Yeah.
Where am I?
And you know what you said about vitamin D? I just want to mention this real quick. What you said about vitamin D, most researchers agree that vitamin D is probably the most important vitamin for the immune system. And I think what you just said earlier just
very strong, yeah,
brings that out, yeah.
So let's see. Somehow I flipped to a slide on vitamin E and lung cancer. Okay, we went over the vitamin E already. I guess I'm a little backed up on my slides here. So overall on vitamin E, just to recap, we can't find any strong studies showing it protects against cancer, but and then the data is mixed on prostate cancer. So let's talk about selenium. This is a micronutrient that's getting more and more attention lately. It's a mineral that comes from the soil. But the only place in the United States that has adequate selenium in the soil, believe it or not, is North Dakota. So unless the bread that you eat was from wheat grown in North Dakota, you're probably not getting enough selenium. It's taken up by the body and becomes a part of about 25 different enzymes and other proteins. And so the selenium plus protein complexes are the active thing. So the selenium itself has to bind with various proteins in the body, and it's those protein-selenium combinations that are actually active, and they have antioxidant effects. They neutralize toxins, especially things that damage the cell walls or damage our genes. Let's see, what else here? Oh, I guess there's some soil in Nebraska that also has it. Sorry, I didn't want to leave out Nebraska. Now, some meats and some nuts also contain selenium, but mostly it comes from wheat. So many studies have shown that the higher the level of selenium, the less chance of getting certain cancers. People with high selenium blood levels, just from what they eat, have a lower risk of cancer in general, and specifically a lower risk of cancer of the colon, the prostate, and the breast. People with the higher selenium levels had a 60% lower rates of the non-melanoma skin cancers. People with high levels of selenium and folate had a 50% decreased risk of colon cancer. Now, other selenium and folate combinations didn't protect against colon cancer. So, you know, I mean, some studies show that this combination of selenium and folate was what was important for colon cancer, but other studies really didn't show that. So the studies on that one are sort of all over the map. Now, what about selenium supplementation? Well, giving selenium at supplements of 200 micrograms per day reduced the risk of getting prostate cancer in one study, but didn't have any effect on colon cancer or lung cancer. And it turns out that males and former smokers got the most benefit from selenium supplementation. when they looked at just selenium blood levels, and this is naturally, not from supplements. I'm sorry, selenium blood levels before taking supplements. People who had low levels of selenium, who then got on a supplement, they had the greatest reduction in their cancer risk. Now, people who already had naturally high selenium levels from their food, if you added a supplement on top of it, it didn't really affect their cancer risk that much. So this may be one instance where it really makes sense to check blood levels of the mineral before you go on a supplement or go recommending a supplement. People who already had, in fact, it went the other way. People who already had high levels of selenium just from their natural diet, they actually had a slightly increased cancer risk when extra selenium was taken. What we found is that this selenium supplements at a dose of 200 micrograms per day, it decreases the overall total cancers. But in some people who are getting a lot of sun exposure, it could increase the non-melanoma skin cancers. Now remember, melanoma is the kind of skin cancer that could be deadly. And the other skin cancers are the ones that you just sort of scrape off every now and then and tend not to be deadly. So this may be because selenium does seem to work in conjunction with vitamin D, and we don't know if the selenium is actually causing people to actually get an excess of something. Again, studying these minerals and these supplements and isolated the way we study drugs just doesn't seem to give us straightforward answers. Interestingly, when people were given selenium supplements at a higher dose, at 400 micrograms, it didn't affect cancer risk at all. It was the lower dose that affected the cancer risk. Another study showed that people who had baseline low selenium levels and they were given selenium supplements, it lowered their prostate cancer risk by an astounding 50%. But in people who already had high selenium levels and then they went ahead and put them on selenium, it didn't decrease their prostate cancer risk at all. So what this seems to show is in people who are selenium deficient, they need selenium to prevent cancer, but in people who aren't selenium deficient, there's something else causing their cancer. There was a really big study in China that showed a combination of only 50 micrograms of selenium along with a low dose, 30 milligrams of vitamin E, and a minuscule dose, 15 milligrams of beta-carotene, led to a decreased death from all causes across the board, decreased death from all cancers across the board, and specifically a profoundly decreased death from stomach cancer. And these are pretty small supplement doses here. Now, it could be that they were looking at a Chinese population that just at baseline was undernourished or wasn't having a balanced diet. So selenium is just a very interesting one. The problem about selenium is in very, very high doses it can be toxic. And there's a little evidence to suggest that if you already have a naturally high selenium level and take selenium supplements on top of that, you might actually increase your cancer risk. But this is one case where it really might make sense to actually check your selenium blood level. So these mixed results really mean that selenium supplements can't really be strongly recommended in the absence of a blood test, in my opinion. Not that I'm giving any medical advice, right? In conclusion, now again, there's many, many more nutrients that could be studied. The bottom line is that there is no substitute for Mother Nature. None of these nutrients works in isolation, and studying them in isolation can actually be creating deficiencies in the other nutrients unwittingly, and so we get these really, really mixed results. But what is true is that foods rich in folate, calcium, vitamin D, vitamin E, vitamin A, and selenium definitely protect against all the most common cancers that we get in this country. when it comes to supplementation, you really got to take a look at the individual cancer and the individual person, and in some cases actually the blood level, before you go off making very strong recommendations. So as with any type of medical treatment, you've really got to find out about what's known and not known about the safety and effectiveness of any particular proposed treatment before you jump in and accept the treatment. And this is actually called informed consent. You've got to get informed before you just say, well, this looks good. One thing I also want to let you know, a lot of people, especially when they have a dread disease such as cancer, the first thing they do is they get on the internet. And they say, well, I'm going to find out all about this from the internet here. And I just want to warn you that over 90%, actually by survey, it's over 95% of medical information sites on the web are sponsored in one way or another, and sometimes indirectly, and sometimes not obviously, by somebody that has something to sell and something to benefit and gets some benefit from selling you their product, which doesn't mean their information is invalid. It doesn't mean that there's any ethical problem there. It just means that the consumer should know that there could be a potential conflict of interest and could be a bias in what's being presented. And that's why we have smartmedinfo.com, which is a completely unbiased presentation of information, particularly about conventional medications and drugs, but also what you need to know about, various conditions and tests and procedures. The bottom line is your doctor actually might not know this information or might not be telling you, or the place you're getting the information from may be biased, and it may not be that obvious to you. Are we ready to hear Gary's story?
Oh, absolutely. Thank you so much, Moira. Folks, we're going to take questions in about 10 minutes after Gary has given his story. Please stay on for this. This is very, very important. And in a way, I'm glad we did this after instead of before, because you can now put his story in perspective. But also, we have a lot more people at the end than when we first started. So I'm glad that more people can listen to what he has to say. So, Gary, are you on?
Yes, I'm on, if you can hear me.
We can hear you. Sherry, could you change the screen so I can have control? And
Sure.
Just put up. All right, Gary, go ahead and just tell us your story.
Yes. I think we'll do a time warp speed, and we'll reverse back about 30 years, and we'll see if there's any dots that will connect between what you just heard Dr. Dolan's presentation and maybe my personal experience. My short story, basically at age 31, I was had a tumor show up on my collarbone, a knot, and upon investigating that at the University of Nebraska Med Center, which is was one of the top lymphoma treatment centers in the country, I was diagnosed as having stage 3 lymphoma. And of course, at the time, I thought I was real healthy, just like everybody else walking around. Couldn't believe that they were finding this in my body. After they did all the staging and everything else, they did diagnose it as stage 3. And what the recommendation was is that I do radiation, chemotherapy, and surgically have my spleen removed. And I took a self-initiative, made a self-initiative decision, I guess I'll put it that way, to not do that at that time. And I really felt I needed to go out and look for something that would be non-toxic, that would support my body's ability to possibly deal with this condition without invasive toxic therapy or removal of an organ. And so as I left the office that day, they told me basically I would be gone within 6 months. Doing nothing, as far as they were concerned, at the stage I was in, was a sure death sentence. And not doing what they said was the same as doing nothing. But I proceeded anyway to go on a mission that lasted about 4.5 years. And I started reading every book I could put my hands on in the field of natural, holistic healing, diet, nutrition, and I started implementing different strategies. I went to the Kushi Institute on macrobiotics, learned how to cook the macrobiotic diet, and ate that for about a year, which consisted of whole grain rice, miso soup, seaweed, and those types of foods. prepared in a certain way. I also, during this 4.5-year stint of looking for the answer that could potentially support my body's ability to reverse that condition, I went on to Dr. Kelly's diet, which was a raw food diet. And I consumed nothing but raw foods for a period of about 10 months. In fact, the whole dietary regime was put together for me. And while I was doing this, I was integrating a lot of nutrition dietary supplements, and I did do vitamin C intravenously at 10,000 units multiple times. Because I looked at some of Linus Pauling's research at that time. At one point in time, I was taking up to 180 supplements with a pretty major focus on enzymes, proteolytic enzymes, animal and plant-based enzymes, because of the research at that time saying enzyme deficiency in the body was a piece of the problem. Worked under the direction of Dr. Hans Nieper in Germany, who had been doing a lot of research with the emulsified vitamin A over in Germany and documenting some rather significant findings using that. So I started to implement 1 million units of emulsified vitamin A, which I took for a period of a couple of years. Many doctors suggested that would cause toxicity of the liver. Well, according to Dr. Hans Nieper, when it's emulsified, it's not metabolized by the liver. It's metabolized directly through the lymph system into the body. I never had any toxic liver. I was juicing fruits and vegetables because I read a number of books where people were doing that and seeing and some anecdotal evidence was supporting a lot of miracles happening, especially coming out of Southern California. I'm living in Nebraska, and and in the middle of the winter in December and January in Nebraska, it's pretty hard to find vine-ripened fruits and vegetables, let alone organic grown. But I did the best that I could, and I really was going at this from a mind, body, and spirit perspective. I have to this day a 4-hour, it was a video of Dr. Bernie Siegel, talking about the power of the mind in visualization and the power of words when it comes to supporting the body's ability to deal with this kind of a crisis situation. So I was really looking at mind, body, and spirit and utilizing just an enormous number of chiropractic treatments and adjustments to make sure everything was in alignment. Acupuncture, I went to one of the top acupuncturists. I worked with Stanislaw Brzezinski in Houston, Texas, and tried for a period of 4 months his antineoplaston A therapy, which was a non-toxic modality that he was having some success with, although I was the very first lymphoma patient that ever went to his clinic. I was really just, I went to the Bradford Clinic. I was down in Mexico and did intravenous interferon and DMSO. And, I mean, if there was something out there that I hadn't tried, I went over and tried it. So I was overlapping a lot of these things. Nutrition throughout the whole time, I was always taking the nutrition. I was always watching my diet. But I would try different, strategies from the standpoint of Brzezinski or, the Bradford group down there. One of the things that I ran into in that, well, actually, I guess it was after that. It was a few years later. I'll share it with you in a minute here. When I'm doing a fast speed going through what I did, because we're talking about 4.5 years here of doing all these different things. The bottom line is this: 4.5 years of fighting that cancer by taking my own self-responsibility and risk and making a choice to go out and do all these things produced for me 4.5 years of life that obviously I wouldn't have had I done, had I done nothing, because they said I'd be dead in 6 months. And what but 4.5 years into the battle, I still had the cancer. And what I had managed to do with all those different modalities and with all the technology known at that point in time, I was back in 1977 through 81, I basically had managed to slow the course of the disease down, but I could not get on top of it and get it reversed. It had a pretty good grip hold on my body. And for whatever reason, I could not get it totally out of my body. So in 1981, I made a decision. I really came to a point of I didn't know what else to try. I then decided to go ahead and do what today is considered an integrative approach. And I went into the hospital and I took a treatment under the direction of Dr. P.S. Johnson at Bergen Mercy Hospital in Omaha, Nebraska. And he offered me one of 3 chemotherapy regimes. One was very toxic, one was a middle of the line, and one was what he considered to be the least toxic. Well, I asked him to please give me the least toxic 4-combination drug treatment therapy. And he said, well, we can do that, but you still will lose all your hair, and you're going to be pretty sick when we give you the treatment. And all I can tell you is I took that treatment outpatient for 9 straight months, once a month, and I didn't lose any hair, and I wasn't sick a day. And now I don't know, I don't have proof on this, but I suspect all the nutrition I had been doing 4.5 years prior to that, doing everything I could possibly think I could do to support my body's immune system and give it a fighting chance, probably played some role in that, and I continued the nutrition right through taking the chemotherapy too. So I kind of suspect that, and I think I heard in Dr. Dolan's presentation there where even certain vitamins have been shown to reduce the toxicity, effective of chemotherapy. I think I did experience that. And so it really, I'm here on the phone today because I think I did both. And to be honest with you, I think I did them in the right order. I think if I had to personally do it all over again, I'd do it in the same order. Maybe I could have done them both at the same time. But I happen to believe in my heart that building the body up is important. I'd had mononucleosis in college, diagnosed in my senior year during finals, which is a viral attack on the immune system. I later learned increased your risk factor by 7-fold for lymphoma cancer. So I've carried that virus around, and I can look at my dietary habits, my lack of really true understanding of nutrition, and really making good lifestyle choices all set me up for, at age 31, going into that battle. Something very interesting, when I was doing all the research and traveling around the country, I ran across a statement which I've never forgotten that was given by Senator McGovern. He was commissioned to head up a Senate Select Subcommittee back in the late 70s there to go out and research with the top epidemiologists of the United States why the health of this country was headed in the direction it was headed. And when they completed that research and study, it all came down into one final statement that he made. Here's the statement. He says, the lack, excess, or quality of nutrition is the nation's #1 health problem. The threat is not beriberi, pellagra, or scurvy, but perhaps the more deadly reality of millions of Americans loading their stomachs with foods which are likely to make them obese, induce cancer, heart disease, diabetes, etc., in short, to kill us over the long haul. And as I think back at that statement, lack, excess, or quality of nutrition, I can't help but think what Dr. Dolan just shared with us here. Where some nutrients in high amounts caused a problem. Increased maybe factors of risk factors. Maybe a high dose of one thing was throwing off something else and creating a deficiency in something else. So lack or excess is critical. Quality, I think when you're talking quality, the quality of our food chain today has dramatically changed in the last 30, 40, 50 years, and the soils and everything else. I mean, it's not easy to say, well, just get it in food, but if it's not in the soil, i.e. selenium's not in most of the soil of this country, it's not there. If it doesn't end up in the food, then where are you going to get it? Which really places a case for dietary supplementation, but I think the key, and there's no absolute proof of this yet, but food form, food-based, plant-based vitamins and minerals would appear to me, especially if they're put together in some semblance of balance, even if you're not necessarily, doing a deep analysis on each person to find out what they're deficient in or what they might be needing more of. To me, getting it in a food matrix where the body can utilize it at the cell level makes a lot of sense to me. And I think eating a variety of foods, because the other problem is we know proteins, carbohydrates, and fats are important, but the quality of the protein, the quality of the carbohydrates, and the quality of the fats, very critical that you choose the right ones. And then you must look at also what has been done to those foods. whether it's animal food that's been, utilized hormones, antibiotics, and, corn-fed, which increases the glucose level and the fat content many, many times. It's all changed. Meat, milk, dairy, animal products are not the same as they were when our great-grandparents walked out into, out in the backyard, out in the farm, and milked the cow and brought the milk in or whatever. And, the chickens were running around. They weren't being grown in these types of situations they're going in now, and kept alive with antibiotics and everything else. And the whole thing has changed. So I think that this evidence and science looks very, very interesting. It gives us some indications as to what we need to be considering. But I agree with Dr. Dolan. I was at the Scripps Integrated Medical Conference 2 years ago, and I heard all this research from Center Stage out there about vitamin E and vitamin C and beta-carotene. And the problem is, how can you isolate one nutrient factor like that? Go take it in some high dosage, high or low dosage, whatever the difference is, and have it be, furthermore, in a synthetic form, and draw any conclusions that have that much value at the conclusion of those studies.
Exactly. Well, but there's enough people who have done very good research on composing nutrient supplements that are what they claim to be balanced. And, how about doing some studies with those supplements?
That's what they need to be doing. I think anything that can get close to the food chain from a dietary supplement perspective really needs to be studied. And but the problem is, even there, you got isolation. You can study vitamins and minerals, but how much more powerful would a food-based vitamin and mineral dietary supplement be if you had adequate support in the other areas and systems of the body, such as plant-based sterols, as an example,
exactly.
Or adequate antioxidant support. Also, the saccharides that are being found now have be a very important factor with glycolipids and glycoproteins. I mean, when you start synergistically combining some other deficiency categories, what synergistic effect would that bring to the table? I don't know if there's enough money out there to study all this.
Yeah, you bring up something really good there. We're, what I talked about here was mostly the micronutrients, but what about the macronutrients and this whole area of the glycoproteins? What for a long time were considered not even worth study. Here they find out that these sugar molecules are, they're functional in the body and they're therapeutically active, and they were just ignored for the first, 80 years of conventional biochemistry.
Yep.
So yes, looking at these macronutrients and the quality of them compared to these micronutrients and how they work together. For instance, selenium itself does not seem to do anything, but selenium in the body gets incorporated into a couple dozen different proteins, and those are the active agents, actually.
Well, it's an enormous task, I guess, to go out and find the key to what's missing and start facilitating some answers for the public. And there'll be a lot of experimentation that will occur along the way. My experience has been in the last 30 years, and in particular the last 13 years, that the power of plant-based nutrition in a dietary supplement form, combined with better dietary choices, lifestyle choices, exercise, drinking more water that's pure, and mind and spirit, with a more balanced approach. I know there's going to be a doctor coming on here in the near future. I have to get to the cancer series. That's one of the top is the medical director of one of the top integrative clinics in the United States, who speaks all over the country. It'd be an interesting call for all of you when that does occur. But I think my 10 minutes or more of my 10 minutes are up here, so I think I'm going to just stop and say you're on the right track. I mean, my experience would validate everything I'm hearing, and I think we're on a journey of discovery here. And through it all, we have an opportunity to potentially save our nation from some catastrophic challenges that will be presented to us in the coming decades here.
Absolutely.
Well, thank you, Gary,
so much
for
again.
that great. I really appreciate it. When you look at some of these figures that I was giving of 30%, 50%, in some cases even a 90% reduced risk of various cancers. If there was a chemotherapy drug or there was a pharmaceutical that gave that kind of figure, or even gave a fraction of that, it would be a bestseller. I mean, we look at Lipitor, which is the best-selling drug in the world, which only reduces the heart risk in 1 in 300 people that are taking it. And then we take a look at some of these nutrients and look at these tremendous numbers that I was quoting, and when you don't have a big machine behind it that's going to stand a profit, it tends not to get to be well known, but certainly with numbers like that would make a fantastic difference in, as Gary was saying, just overall health of the nation for some very expensive illnesses.
Absolutely, and I think in Gary's case, I mean, one of the advantages he had was that he had the time and he had the ability to actually, and he had the know-how, the mind, body, spirit thing that he speaks of. He had the know-how to really search for answers against all objections and against all the advice. He searched for answers, and I think that's why he's alive today. He had the desire to, and that's what we're trying to bring to you folks. It's of extreme importance that that desire, that determination, that will to live, that will to win, so to speak, is there. And so with that in place, you can continue the search. And back in Dr. Gary's time, for instance, there was, I would say, nutrients and nutritional supplements were extremely expensive because they were not as available as they are today. Today we have a plethora of great nutritional products. We mentioned some at the beginning. We mentioned a company that is researching actively how to help people overcome the worst conditions. And if you want it, again, if you want us to type that number or that phone number and that address in, we shall do so. But just know that there are answers out there, and you should continue to search. Okay. I think we can go into questions now, right, Sherry?
Sure.
Sherry, okay.
No.
All right. Now remember, folks, if we don't cover the questions that you have, we may not, because there are lots of questions. There's a forum available on our website homepage. Just go to our website and you can type in your questions to Dr. Dolan. She has graciously agreed to answer your questions on the forum there. So I think that's just fantastic. All right, Sherry, go ahead.
Okay, let's see. I always save all the ones with the big words that I'm afraid I might mess up for you, so let's see.
Okay.
Can vitamin A, provide a benefit for patients with bowel cancer?
Okay. There's so much data, there's so much information that for any particular vitamin, it's not like I really have it in my head. Let's see. Definitely, there's the there's studies showing that precancerous stomach lesions can be prevented from turning into invasive cancer. There's results on breast cancer and ovarian cancer, and as I explained, there's mixed results on lung cancer. I don't really see of any of the studies that I looked at that there was any kind of strong evidence that mentioned colon cancer. That doesn't mean that it wouldn't work, you see. It just means perhaps that the study hasn't been done. One thing we know about colon cancer is that it tends to be slow growing. So any study that you're going to do on colon cancer really has to go out, a good 10 to 20 years. And so when we look at, like Dr. David was saying, the availability of nutrients and what people have been taking, for instance, I know that back in the 1960s, in order to get more than about 5 IUs of vitamin E, you had to go to a compounding pharmacist and get it specially made up for you. Anyway, so I don't see strong studies in what I was able to find regarding vitamin A and colon cancer.
Okay.
Just want to remind you folks that the DVDs and CDs will be available. You can actually purchase them at our website after the webinar. There's a link to buy the DVDs. Just DVDs now, right, Sherry?
Yes, yes, DVD.
Okay.
Here's another question, Moira. As far as supplementation, is there a difference between tablet, liquid, or just getting it in the whole food?
Well, there definitely seems to be a difference getting in the whole food, and the main thing there is that it comes along with other micronutrients that nature packages it with, and it's usually the micronutrients that it works in conjunction with. However, like I said, what we get from fruits and vegetables is beta-carotene, and that's got to go through a couple of transformations before it's really available to us. Vitamin D3 through the skin has to go through the liver and the kidney before it's in a functional form for us, whereas we could take D3 by mouth in a supplement. But when it comes to the actual form, I mentioned calcium seems to be best in a dissolvable powder, which may seem like a hassle, but they've actually done x-rays on people who take different types of calcium supplements that you just get over the counter or Walgreens, and they've done x-rays on them watching this calcium tablet go all the way through the digestive tract, and then they find it, at the end exactly intact. So when you have something like calcium and magnesium, that does seem to be taken best in a dissolvable powder form, which I think is a good idea anyway. You're going to take it separate from your other nutrients because sometimes it can impair the absorption of the other nutrients. So these one-a-day tablets or these combination tablets that have that are huge horse pills, they're most of that bulk and space is taken up by the calcium and the magnesium. And then you have everything else. And I don't think it's a good idea to take a compressed tablet. I think it's too hard for the body to break down. And I think the most readily available form, calcium and magnesium, should be dissolved in hot water till the water's actually clear. They're actually dissolved in the liquid, not in a suspension. I think that the B vitamins, which are water soluble, and vitamin E are best taken. B vitamins and vitamin C are best taken in a powder form with water. And the vitamins that are oil-based, that would be A and E and D, you can just take them with meals in a little capsule, a gel cap that's readily broken down. But to try to get all of those things in one tablet, first of all, you're not going to get the appropriate ratios, and you're not going to get the needed doses. They can't make a tablet that big. And they're going to be in a compressed form, probably in combination with calcium, which is going to impair the absorption of the whole lot. So, unfortunately, like we were talking about, selenium is only available in this wheat grown in the Dakotas and Nebraska. And we do have to take supplements, and some people may feel it's ridiculous to go around with a little pill box container, but unless they're eating whole organic foods and getting leafy green vegetables 5 times a day and all that, I really don't know anybody that does that.
Right.
Then this is what we're going to have to do. Now, the people who juice have a better chance of getting all of this, actually. But aside short of juicing, it's hard to get it unless you're taking supplements.
Right. A couple of people asked about getting with IV, doing IV vitamins. Do you have a comment on that?
I personally, as a treating physician, don't have a lot of experience with it. Most of what you can read in the medical literature on that is anecdotal. In other words, it's people's individual success stories rather than controlled studies. But certainly there is a big following of that, and as individuals, people have reported great success for a whole variety of things. Worst case scenario, you waste some money and pee it out. The most studies that have been done to really support that, as we mentioned earlier, from Linus Pauling and the Linus Pauling Institute, that do show, do have some studies on that, but in general, anything that's not going to be supported by big pharma dollars, isn't going to have the type of long-term placebo-controlled study that we're used to in the medical literature to really point to for definitive answers. So you are left with, one, is it biologically plausible that something like that would work? Two, is there, experimental studies in the lab that shows it works? And three, are there anecdotal reports or short studies or uncontrolled studies that show, one, it seems to work, and two, there seems to be no harm or tolerable side effects. And so that's really what we're left with in the alternative fields, or complementary, however you want to call it, if there's no big pharma money backing the type of studies we'd really like to see.
Okay. Here's a comment. It says, I presume when she says people who take supplements are at higher risk for lung cancer, she means targeted supplements like vitamin A, not multiple vitamins / minerals.
No, hopefully, let's review the tape. I hope I certainly didn't say that, because, as I went through all of this, in all this medical literature I was reviewing, there was conflicting data on almost every one.
Right.
But the information regarding vitamin A and lung cancer in people who are actually taking high-dose beta-carotene supplements does seem to indicate an increased risk for lung cancer in at least 2 large studies. Now, other large studies have not shown that. And the other one where there's a big question mark is the calcium in prostate cancer. On the other hand, there's so many other studies showing benefit of calcium across the board in all different kinds of cancers that it's really hard to really just isolate out prostate cancer and say, well, therefore you shouldn't take it. Aside from those 2 instances, the calcium in prostate cancer and the vitamin A and lung cancer, the story is very, very mixed with all these supplements. You can find studies pointing in one direction or the other. One thing that they tend to do in studies, they tend to collect data that's going to give them the answer that they want. And this sometimes tends to lead to a real blind spot, kind of having the blinders on like the horses coming out of the gate, where they're only looking at this one thing and they're failing to look at other things. Like it could be that the reason that certain nutrients are tremendously effective in studies that come from China or from India or Africa, it could be that we're looking at a generally undernourished population to begin with, and any nutrient in that population is going to improve health.
Right.
And so there's some factors that they're maybe not looking at. So any given study, I mean, you could dissect it out and dig into it, or you could, what I've done is I've just said, okay, there was a large study and it showed this and it showed this and it showed that. Then you have this other study that has conflicts. I definitely cannot make a statement that people who take supplements have increased risk of cancer. The only strong evidence for that, like I said, is the vitamin A and the lung cancer. And these were mostly smokers who also had asbestos exposure. But other studies did not find that. So, it could be what we call selection bias.
Right.
Because of the population you're studying, you're more prone to find a certain answer, and that may not be generalizable to the general population.
Right. I think also folate too. I remember when I used to treat cancer patients, folate was particularly a problem. I mean, that was the general thing we were meant to be to avoid, because, as you just mentioned, it seems to help proliferate certain kinds of cancer. That was a general belief. But in general, a good food-based multivitamin supplement that even contains folate should not give that kind of
well. And again, were they looking at folic acid, which is what most of the things are, which is what the breads are fortified with, or were they looking at natural plant-derived folate? And that's the risk seems to come with folic acid, and this is absorbed and used much more readily by the body. Maybe it's an inadvertent toxic form.
Right.
So just because we find something new and improved doesn't necessarily mean it's better.
Right. So speaking about the fortified bread, is all the breads produced in the United States and Canada fortified with folate?
I can't speak for Canada. I know they have fortification up there, but as far as I know, all the commercially produced bread in the United States is folate supplemented.
Really?
And it may not happen at the baker. It may just happen at the stage of the flour. Flour being folate supplemented.
So white flour isn't all bad as we believe. some
well,
good
again, it might not be the whiteness of the flour that's the bad thing. So another example of kind of a skewed look at something, what is doing it?
Antioxidants. I know you touched on it. What oncologists notoriously tell their patients to stay away from all kinds of antioxidants because it interferes with cancer treatment. I know you mentioned that with vitamin C, but in general, let's talk about antioxidants in general.
Well, I mean, it's biologically plausible that that could be happening because I mentioned for almost all these nutrients, including the minerals, that one of the things that they all seem to do is they protect cell membranes. And almost all of them that I covered today have something to do with regulation of cell growth and reproduction. So if you are intentionally taking a toxin in order to break down cells and interrupt cell reproduction, then to be taking a nutrient that's going to regulate that and protect it seems to be, it would counter it, right? But again, like I said, maybe we're studying the wrong things. Maybe we should look at how can we bolster up the normal tissues, which it sounds like Gary did, in order to be in better shape to fight the cancer and to respond to the chemo. But in the test tube, in a petri dish, in a cell culture, could some of these substances counter the effect of chemotherapy? Yes, it's biologically plausible. Does that mean that that's what's happening in the body? There's no proof of this, but it's a really hard thing to study.
Some studies actually say that cancer cells use do not make use of antioxidants as well as the normal cells do, and that's the argument for using antioxidants. And also the other thing is that the antioxidants help to bolster the immune system, like you just mentioned. So having the immune system less burdened provides them with the ability to fight the cancer and the immune cells, that is, to fight the cancers. So we don't know, but I don't think you can go wrong with proper nutrition, like as Dr. Williams said. Let me just put that quote back on. I think it's such an apt quote here for tonight.
Well, and especially as Gary mentioned, he did a powerful juicing program, particularly if you're doing that with stuff that's very fresh and organic. And that's one way to span the, you're not just trying to get it all from your diet, and you're maybe a little shy about taking some supplements, but if you do juicing, you're really getting the best of the best, and you're getting it in a concentrated form, and you're getting it in a way that you can consume it. If you tried to get all the nutrients you get from juicing by actually cooking and eating all that food, you'd be eating all day and all night. So that seems to be a happy medium. And what really shows from all these studies is the tremendous and undisputed value of nutrition is in prevention. Once you have a cancer, I think you really got to take a look at what might be good for you. And with certain things like vitamin D3 and selenium, it seems like it's hard to go wrong, even during treatment, right?
Right.
And even vitamin C. For other things like vitamin A, there's some question as to whether there's actually some harm being done in certain cancers. And for vitamin E, there's no strong studies for vitamin E alone, but vitamin E is one of many other micronutrients that have antioxidant effects, may well be an essential nutrient. And like I mentioned twice the study that showed selenium and vitamin E taken together and the effect on colon cancer. whereas that effect was not seen with either nutrient alone. So, and certainly if you have something like a precancerous lesion, an abnormal pap smear, or H. pylori infection of the stomach, or Barrett's esophagus, a precancerous lesion of the esophagus, or colon polyps, it does seem like there are definite nutritional things that you can do to prevent the progression. It also just seems very intuitive to really, have good nutrition and support the healthy cells while you're going through chemotherapy.
Moira, I have one question.
Well said.
One of the questions was that you had mentioned with tomatoes that the lycopene was more available when it was cooked. Is that the only vegetable that is that way? The question is raw better than cooked, except...
Well, it's not just cooked. If you smash it and concentrate it and dice it up, I mean, sort of like they just, extract it, concentrate the juice. Tomato paste is higher in lycopene than a fresh tomato, just in terms of the concentration.
Okay.
So, you may lose some essential micronutrients in the processing. So again, they're looking at that, just sort of a biochemist independent of the actual body. Oh, we get more concentrated lycopenes, and maybe that's not such a good thing to do. I mean, maybe it shouldn't be independent of its other co-nutrients and trace minerals that come with a fresh tomato. But even just chopping it up or blending it up gives a higher concentration, or it makes the lycopene more available, funny enough, than just a fresh tomato. I don't know if that relationship with any other nutrient. But like I said, retinol is the animal form of readily available vitamin A, whereas what vegetables have in it is beta-carotene. And yet some people feel that the beta-carotene is less toxic because the body has to go through a couple steps to make it bioavailable, and is less likely to, from its natural form, overdo it. So the bottom line is you can't fool Mother Nature. And we're sort of like gorillas trying to program an iPod when it comes to isolating these nutrients and say, this is the best thing. And you could see it in the fads in the health food stores. Like selenium is enjoying great popularity right now, and there seems to be a lot of evidence toward it, but does that mean you should just, as an isolated nutrient, really take a lot of selenium? Certain amino acids are like that too. Glutamic acid was very popular for a while, and then people realized taking it alone was probably not a good idea, that you really needed a balanced amino acid intake. So there are some hazards to studying these things alone.
Well, I think this has been a masterful presentation, and folks, I think we are going to transcribe this, because I think this is the kind of information you want to read and listen to and watch over and over again, and share with your doctors, because I tell you, a lot of doctors do not know what Dr. Dolan has shared tonight. And so, Dr. Dolan, I just want to thank you again for taking the time to do the research. And
well, I'd really encourage people to at least get the handout, because of the conflicting nature of all the data that I gave. It can be kind of hard to sort out unless you have it like right in front of you. So at least people should get the handout to go, okay, now what was more and what was better and what was worse? And again, I just outlined the conflicting studies there, so I think the handout would be particularly valuable in this one.
Absolutely. Absolutely. You can get the handouts from the homepage of our website. You have the address right at the bottom there. Well, excellent.
Okay,
any final words?
On smartmedinfo.com, we address at this point mostly just basically conventional treatments and conditions, but we've had such an increasing requests for addressing nutrition and herbal treatments and the nutraceuticals and things like we were talking about, the glyconutrients, that we are, now starting to have posts on those types of things. So this type of information is also available at smartmedinfo.com.
And there it is.
Great. Well, thank you for having me. It's always a pleasure, and I love the questions from the audience.
Well, thank you, and they're going to keep coming, right?
Oh, yes.
Keep coming, and if you would just check up on the forum part of our website from time to time, and that would help. Sherry, did you want to say something? I think I made a mistake in what I just said. So, Sherry, why don't you clarify that?
Okay, if you are interested in either the handout or the DVD of tonight's presentation, you will go to our website, thebuildingstrengthwebinars.com, and at the top level there's some buttons. One says Online Store. You click on that, and then you click on the word Webinars, and then there's a list of topics, and you click on Micronutrients and Cancer, and that's where then you'll see the DVD and the handout. So it's Homepage, Online Store, Webinars, Micronutrients, and Cancer.
Okay, great. Good night, everyone, and have a great weekend, and see you Tuesday and Thursday.
Good night.
Bye.